Hey everyone, how you doing? Thank you for joining me in my latest Medicare Monday video. So today is going to be a little bit something different. In the last few weeks, I've been discussing the things that Medicare covers that you would be possibly surprised that they cover, right? Today, I wanted to provide you with some information that has been coming down, has been being released from CMS, which is the Center for Medicare and Medicaid Services, as well as an update on the Inflation Reduction Act of 2022. Um, so, as you all know, or possibly have heard of, the Inflation Reduction Act that was implemented by the Biden-Harris administration in 2022, uh, did a few things with prescription drugs. Right, the first thing it did was it capped the co-payment for insulin to $35 a month, which is great. It was something that was needed. There were some insulin costs out there that were pretty expensive and impacted a lot of people with diabetes and insulin dependency, right? Um, so the latest thing that's going to be coming forward from that Inflation Reduction Act is starting next year, 2025, the cap for out-of-pocket spending on a Part D prescription drug plan is going to be $2,000, which means that once you reach your out-of-pocket cost of $2,000, that you will not have a copay for any of your prescriptions, which is huge, right? Uh, Roughly the 10-year period between 2012 and 2021, roughly 5 million people spent $2,000 or more a year in their prescription drug class. So that impacts a lot of people with putting that $2,000 cap on your out-of-pocket cost for prescription drugs. Um, there is a flip side to that equation, though. Okay, any cost above that $2,000 is now going to have to be absorbed by the insurance companies or the carrier, right? And how do they plan and how do they adjust um, the liability that they now have of covering that cost above the $2,000? That's where the issue comes into play. So a lot of people that I've been listening to, a lot of experts that I've been listening to and watching and reading about, really kind of predict a possibility of a 50% increase in your Part D premiums a month, right? Meaning that if you're paying $40 a month for your Part D prescription drug plan, now that gets raised up to $60 a month, right? Plus possibly some co-payments are increased. The companies are going to have to compensate or cover any costs that are above that $2,000 for individuals who currently do have that much cost or out of pocket cost, right? Um, Advantage plans are not going to be immune to this either, right? MAPDs or Medicare Advantage plans with a prescription drug um, benefit is the same as a Part D individual plan because you are receiving your prescription drugs through the Medicare Advantage plan. So Medicare Advantage plans are really known for their additional benefits and things like that. What possibly could happen with those is that those additional benefits could be reduced. Um, Co-pays, co-insurances could be increased. Monthly premiums could increase, or a monthly premium could be implemented on a plan that doesn't have one right now. Um, Again, these are all things that are possible. We really won't know exactly what each individual plan is going to do to take on this liability that the Inflation Reduction Act is put on them. But changes are coming, right? Um, so the other thing that was passed down uh, or was announced was the reimbursement rate that gets paid back to doctors and healthcare providers that provide services for Medicare beneficiaries, right? That reimbursement rate was increased by 3.7% this year. But the cost of healthcare, the inflation itself, um, has risen above that 3.7%. So most doctors and carriers and providers are really kind of considering this a cut in reimbursement. Okay. So again, what does that do, right? What could that do, right? What it could do again, just like with the Inflation Reduction Act, uh, additional benefits could be reduced. For example, if you have a dental plan with your MAPD or your Medicare Advantage plan that provides $2,500 of dental coverage a year, that could, possibly, for an example, be reduced to $1,000. Um, Benefits could definitely be impacted as far as the additional benefits could definitely be impacted by this. Again, along with rising copays or co-insurances or premiums and things like that. Um, so you might be asking, okay, so what should I do? Right now, there's nothing to do. This is merely me providing you with information that of things that are coming for next year, right? Or possibly could be coming for next year, right? Again, we won't know exactly what individual carrier or which individual insurance plan does to offset these costs until they start releasing the plans later on this year. At that point, once the plans are being released and once I can sit down with you, then we can look at your plan uh, for 2024 compared to the plan for 2025, see what has changed, and make sure that that's still a great plan for you. If it's not, then we look for different plans that better fit your medical needs and your financial needs, and then go from there. Again, not knowing exactly what those are until those plans are starting to be released later on this year. I simply just want to make sure that this information gets out to you so that when you open up your ANOC or your annual notice of change that the insurance companies send to you, that you're not taken off guard, that you have at least a little bit of understanding of why the changes are coming, and that there are options, right? It's not there are going to be plenty of options out there to choose from if the plan that you currently have isn't the best fit for you, right? And again, that's where I come in and I can offer my services to you to really kind of sit down, compare both plans, compare it to the other plans that are out there available to you in your area, and see which one is best for you. So I hope this video really helps. I mean, I know it's a lot to take in. It could be potentially scary, but I don't believe so. Again, I think there's a number of plans out there that really will be able to fit something with you to make sure that it fits both your financial and medical needs, right? Um, but if you have any other questions regarding this video or any other aspects of Medicare, please feel free to give me a call. I have my number down here below. That is my Medicare information number. Please give me a call on that. We can definitely schedule something to sit down and talk one-on-one. Also, I put my QR code up here in the corner in case you're watching this on a different format than YouTube. You can just scan that QR code. It'll take you right to YouTube. Once you're there, though, subscribe, right? Become a follower and put the notifications out so that any other videos besides my Medicare Mondays video series comes out, you'll be notified of that. And if you like this video, do me a favor, give me a thumbs up. Put any comments that you have or any questions that you have in the space below this video, and I'll definitely get back to you on that. And again, I'm here to help you navigate a difficult system, right? And if you have any questions, any concerns, please feel free to give me a call. And in any case, I hope you guys have a great day. Make sure you look out for my next Monday Medicare video coming out next Monday, right? And I hope you guys have a great day. My name is Danial Partridge, and I am your independent Medicare agent. You guys have a great day. Thank you.